So our next speaker is Pamela Wilson. So Pamela comes to us from Nine Patch, where she works at a company which, of course, because it's me, there has to be a little technology at one of our events, where they focus on the link between healthcare, behavioral health, mental health, and social care. Pamela is a certified senior advisor and has a certificate in dementia care. So Pamela, I will turn it over to you, and thank you for coming.
My pleasure. So everybody, if you would do me a favor, I'm going to do an intro here, but it would be interesting for me to know where you come from, since I'm going to mainly be talking about how employers can help employees who are caregivers. So if you do me a favor in the chat, if you could just say, you know, I'm here as an individual, or I'm here as part of a company, or I work for an agency, that would really help me a lot. And then please do feel free to put your questions in the chat throughout my presentation, because if there's something that I can answer as I'm speaking, I would love to be able to do that. Otherwise, I can hold them until the end. So I'm going to start. Thank you for putting all those in. I'm watching where everybody's coming from. So I appreciate that very, very much. So I'm going to give some context on the employee caregiver background, just so you kind of know where I'm going to take this presentation. So caregiving is a lifelong role, and we often don't see it like that. The word caregiver may not come up until you're with somebody and you're at a doctor's office and somebody says, oh, you're a caregiver. What we don't consider is that caregiving starts at birth. So if you're parents and you have children, you're actually a caregiver for your children. And if you're an individual, you're actually a caregiver for yourself. And if you're a married couple, you care for each other. And with age, we begin caring for our spouses and our aging parents and grandparents and other people that we know. And then obviously employees who work in the care field are caring for everybody. So there's that context. And then there's the other context of like size of employer, type of employer, whether you're local, whether you're regional, whether you're national. And so that can affect how you provide support to your employees. And so let me go through. And so the goal for this is, if you are an employer, if you work for an employee company, by the time you leave here, I'm going to raise a lot of questions. So you may have some homework to do. And that homework would be, well, gosh, I know we have people that work for us. How many of them are caregivers? What are their roles? What could we be doing for them? What should we be doing for them? And then I'm going to give some examples of what employees all over the country are doing, because depending on your type of business and the employees that you have, what you do may be very, very different. So let's talk about, like, why do we even need to talk about this? And so we're going to do 4 things. We're going to talk about factors that I know many of you know, because I'm looking at the chat and I'm seeing where you work, right? So why do people even need care in the first place? And then what are those gaps? And the importance of meeting family caregivers where they are. And where they are is relative, right? It could be where they are, whether they're caring for children and parents or grandparents or a spouse. And then even, you know, is that early in the care journey? Is it later? Is it end of life? And then how employers can talk about timelines and planning and things like that for employees, because there's so much involved, as you all know. So how does all of this start? Many of you see this. So caregiving usually starts with a health problem, right? And so I have a whole list of health problems here, whether it's high blood pressure, cholesterol, you've got physical disabilities, whatever. So the problem is that a lot of people have undiagnosed health conditions. And this happens in the workplace because when we're young, we think, oh, we're never going to be sick. Nothing's ever going to happen. And even if we're 50 or 60, we think the same thing because we haven't known any different. And so, But those of you who work in the care field, you see this all the time, right? You see people who have health conditions and people who are sick, and one day somebody's healthy and the next day they fracture a hip and they're in the hospital. So there's this whole range of, I'm healthy, nothing's going to happen, to, yeah, I may have high blood pressure, but it's manageable, to I have all these problems. But what happens with employees is that they, depending on, so you may work in a small company. So let's say less than 50 employees, maybe 10, or you may work in a big company. Companies provide health insurance, right? And you usually have a choice, it's A or B or C. So you take that. And because employees want to come to work and they want to do a good job, I think somebody mentioned in the prior, it was Michelle mentioned in the prior presentation that, a caregiver needed to go do some preventative work, a mammogram, and didn't go do it, right? Because there was no time. Well, that's what happens to employees, even if they're healthy, right? And they're not yet a caregiver. They may be rushing around so much and working and maybe going to school and taking care of kids. They don't take care of their health. So these health issues happen. And then depending on if a company has an insurance plan or not, insurance can be what I call unaffordable, and not intentionally so, but it's expensive, right? If you have a high deductible or high out-of-pocket expenses, employees may be less likely to go do that mammogram or to even get their teeth cleaned, because dental expenses are expensive. They're astronomical, right? And so we deprioritize health because we have all these other priorities. And employees may not want to take a day off work to go to the doctor, or they may not want to tell a supervisor, well, I have this condition and I need to go get a treatment, because they want to be seen as good employees and reliable. And how many of you out there, I see all the social workers, I see everybody else here, how many of you go to work when you're sick because you feel like you're needed there and you feel like you should be there? And so that's what a lot of employees do, right? And when you do that, you're less productive. You may be less focused on your work. If you're, in home health or something, you could actually get somebody else sick, which is a concern. So all of these health conditions and the life conditions that I'm going to talk about in a second actually contribute to a need for care or becoming a caregiver. And it's complicated. And so there are things called social determinants of health that many of you may have heard of. And it's kind of the 80-20 rule. So 20% of medical care, like going to the doctor and taking medications and all that, affect your health. But then there's this whole 80% of other stuff out there that causes all of the health problems. And these are things we don't talk about. And these are things that employers don't talk about, and they're not talked about in the workplace. And again, it depends on the range of employees that an employer has. So let me just give an example of a big company. Let's say a food company, right? They may have employees who work in a warehouse, or truck drivers, or people in accounting, or salespeople, or marketing people, right? And so you have this range of people who may have relatively low wages to middle wages to really, high earners, people in the C-suite, right? And so our experience in our life relates to, we think everybody is like us, and that's not true. Everybody's not like us, and that is where these social determinants of health come in. So there's things like, we call it economic instability. So people who are low income, they may not be able to afford food. They may not be able to have easy transportation to get to work. And then we have a lot of literacy problems because people speak all different languages. And if you're a healthcare provider, you know this. Healthcare providers use all these acronyms like IADLs and ADLs and things like that. And consumers do not understand these words. And so they may get a health recommendation, but they don't pay attention to it because they have no idea what somebody's talking about. And then we have access to healthcare, insurance benefits, all these other environmental safety. And then we have the whole family thing, right? Families that get along, families that don't get along, family support. Maybe you've got military members in your family who are going away. So all of this, I call it the crazy stuff in life, right, affects our health. And these are things that employees do not want to share with their employers. And a lot of times employers don't want to know about people's personal problems either, right? But these are the personal problems that cause health issues, that cause employees not to show up for work or to need time off for work or to quit a job because they don't want to do a bad job because they are a caregiver and they have to take care of their kids or a spouse or mom or dad. So we have all of these complicating factors that employers don't even know about because their employees don't self-identify as caregivers. They don't say, well, gosh, I'm a caregiver, right? But they are. They just see themselves as helping somebody out. Well, I'm helping grandma, or I help my parents on the weekend, or I do this, or I have kids, right? Well, they're caregivers. And so employers need to, I don't want to say not use the word caregiving, but broaden the term caregiving to health and well-being and retirement and life and lifestyle, to a much bigger picture. Because if you do a seminar on caregiving and you have employees who are helping out, right? But they don't see themselves as a caregiver, they are not going to show up because that's not me. It's just like older adults will see somebody who's 90 and they're like, I'm not old, I'm not that person, I'm not that, right? We all have pictures of the way that we see ourselves and the way that we identify with other people and the way we relate to other people. And sometimes the term caregiving is so limiting. So these are where the knowledge gaps come up that I'll talk about. So not all employees see themselves as caregivers. Many don't know how to navigate health and benefits and things like that, and the whole impact of caregiving on health. And so one of the most shocking things to caregivers, right, which all of you know, is, man, it's expensive to have to pay for care. And it's different in every state, right? So I know many of you are in Connecticut, but whether you're in Colorado or California or Texas, in-home care could be $20 an hour. It could be $50 an hour. Assisted living could be $3,000 a month. It could be $10,000 a month. A day in a nursing home could be $180, could be $400. So there's these huge variances in the cost of care that people don't even realize until they're like, oh my gosh, my mom's in the hospital and she's getting released at like 4 o'clock tomorrow. And we don't have any care. And oh my gosh, all this care costs and we can't afford it, right? And many companies don't even realize these costs of care, right? Because if we're working, we're kind of insulated from all these costs because we think we have, company health insurance and we're healthy. It's not until you have a diagnosis or you become sick or something happens that you realize how expensive care is. And I'll give an example of preventative care. So the number 2 cancer diagnosis is colon cancer, and that's equal among men and women. And you may see these commercials on television for like Cologuard. They're like, oh, take this test and you can avoid that colonoscopy, right? Which a lot of people don't want to do. Well, here's the problem. If you take the Cologuard test and it comes back positive, you have cancer, right? The better thing to do would be to prevent that cancer in the first place. And that is by going to have that colonoscopy, right? But employees don't want to do that because they may have to take a day or 2 off work. And depending on the health insurance offered by the company, the copay or the deductible could be into the thousands of dollars. And so if an employee doesn't have $1,000 to pay for that copay, right, they're going to take the Cologuard test. And unfortunately, that could mean that this person is diagnosed with cancer. And then they have a whole nother thing that they're going to go through, or a parent is diagnosed with cancer instead of being preventative. So healthcare in the United States is good and bad, right? If you're sick, it is going to give you the treatment that you need, even though maybe you can't afford the copays and the deductibles, right? But it doesn't help prevent. And so talking about health prevention is a significant part of what employers can do to help employee caregivers, not only care for their own health, but to care for the health of the people that they care for. And so that is a super important thing to consider. Now let's talk about things that caregivers should know. And this kind of does get into all of the costs, and some of these things, I'm not going to go into them in detail because I know that other people who are presenting today are talking about them. But, a lot of times people will assume, well, this is just what happens when people get old. They start to have health problems. Well, not necessarily if we focus on prevention. And then a lot of times families will disagree about, well, does mom or dad want this? Or we're in denial about, so maybe I have high blood pressure, but, it'll be okay. I'm not going to do anything about it. The whole thing is all of this caregiving takes a toll on the life of that caregiver in their ability to show up for work every day, in their ability to care for themselves and for their loved ones. And so it's important to have open conversations if you are like a company HR person or you're supporting health in your company about the fact that, life happens. I mean, life happens to everybody, right? You could go out and you have a flat tire in your car or get into a car accident tomorrow, or, a parent falls and has an accident. So things just happen. And the more that we can bring that into the workplace to say, oh gosh, things do happen. It's okay. And the more that we can talk to employees about the fact that, it's okay to take off, a morning to go to a doctor appointment to take care of yourself, or if you have to take care of a parent, because employees are afraid of, getting bad job reviews, of losing their jobs. There's a whole Harvard business study out there that shows that some employers, right, who don't understand this whole caregiving aspect, many of you do because I've seen your background in the chat, but if you have an employer who doesn't understand caregiving from the perspective of caring for older people versus raising children, and really it's all the same. Children get sick just as much as aging parents do, just as much as spouses do, right? So if you can talk about it along this whole continuum of, yeah, you're caring for children and you may be caring for a spouse and parents and somebody else, and you make it all okay and acceptable to do that, right? So the other day I was watching news and people were talking about like, well, can you believe parents are taking time off work to go take their kids trick-or-treating? And I'm like, well, hello, that's life, right? And it's a special thing. So why shouldn't it be okay for employees to take time off to go to the doctor or to take a parent to a doctor appointment? It's like we have to make this whole caregiving thing less of a negative commentary in the workplace so that people don't feel guilty about having issues, because the better the workplace supports these things, the more loyal employees are. Employees will go above and beyond if they have a supervisor who says, you know what, you need to take a mental health day, go take it, come back to work 100% rather than at 50%. Deal with your stress, right? So these are all things that we have to humanize the aspects of caregiving in all of this, because it is just something that's going to happen to everybody. And so let's talk about knowledge gaps for employers. Well, you probably have at least, if not, especially in the caregiving realm, right? People who work in caregiving are already caregivers in their families. So there's like dual duty caregivers, triple duty caregivers. Maybe you're a caregiver at work, you're caring for a spouse, you got kids, you got grandparents, you're taking care of everybody, right? And so, but employers don't realize this. So at least 30% of people in the workplace are caring for older parents or a spouse. And then on the other end, again, we have I'm going to take a sip here. We have the people who are caring for children. So probably, if you think about it, 60% maybe of your employees are in some type of caregiving role, which is why, again, we've got to talk about it. Now, I work with a lot of companies that have what are called ERGs, and they're employee resource groups. And so what they do is they allow employees to form these little work groups. And it could be a group on, children caregiving or elderly caregiving, or maybe it's a men's group or a women's group. And so companies will give these employee groups the ability to have meetings every month, and sometimes they'll give them money to bring in speakers. And so a really good thing to do regarding this would be to take those groups, if you have them, or to create them. And then they're almost like your little research, right? So they're going to really be able to tell you what's going on. Because sometimes you might do an employee survey, and the people in the survey are going to be like, I answer this, they're going to know who I am, and I don't want them to know about this. Whereas if you set up these resource groups, you may get better feedback, because the only way you as an employer can really know what's going on is if people trust that they're not going to, not be promoted, right? Because they have to leave to take mom or dad to a doctor appointment once a month. Or maybe you have a caregiver who has a health problem and they don't want to be seen as, well, if somebody knows I'm sick, then they're going to, I'll be less reliable. I won't get on a team. It's almost like reverse discrimination, right? So people who can be an employee caregiver for themselves or somebody else can fear workplace discrimination. And it does happen, right? So this is where employers need to really understand that there is not one right thing that you can do to help employees. There's a lot of different things, and we'll talk about those in a minute. But the important thing is to meet people where they are. And so people at the supervisory level, it's important to arm them and to train them with appropriate responses if all of this is not referred to the HR department. So let's say that you have an employee and they're saying, I need like 4 days off. I got to deal with a bunch of things for my mom or dad, my parent. I don't have any vacation time. What do? You can let them take time off. Maybe there's other types of leave that the company has. So it's the flexibility to be able to meet that person where they are in the moment and to be compassionate and empathetic about what that need is and to see what you can do about it. Because would you rather have somebody call in sick for 4 days and be wondering like, oh my gosh, what's wrong? Or, something going on? Or would it be better for that person to say, I really need 4 days off, and I know the timing is bad, and I know I've got all this work to do, but I have this problem and I want to be able to tell you about it. That would be a much more positive way to deal with it in the workplace. But I can tell you that it doesn't happen all the time. And that can be scary for employees, and it can be scary for supervisors if you don't know if you have the leeway to say, yeah, we can take care of that, or we can't take care of that, or you got to go to HR to ask the questions, and maybe HR knows or HR doesn't know. So it's having these conversations that is so, so important. And then I want to talk about this caregiver timeline, because this is kind of the whole big picture of all of this, okay? So we have children, parents who have children. Then you've got your aging parents who are coming in. And then in the middle, you've got all these family dynamics, right? So how do we get kids to school? How do we do this? I got to go to parent-teacher conferences. I got my parents over here and they need care, but I got to pick up the kids. And so are we going to be dividing it between spouses, or how are we going to do it? Maybe your husband or your wife is disabled and they need care. And then you've got all the care for yourself. And so depending on, again, where somebody lives, a lot of what happens in states comes from the Department of Health or public policy or population health or legislation. And so what companies may not realize is that there's a lot going on in your state, regardless of what state you're in. And the way that you can find out about this is to, and this may be like an unpopular topic because of everything that's going on today, but state legislation and bills. Because a lot of times companies can become more involved in these things than they think they can. And even all of you who are on this program today watching, you can become advocates for your company or for things that you see if you're a social worker or if you work for a care agency or a hospital or anything like that. You can get involved. So there's public comment on all of this, right? And I'll give a couple of recent examples. So Center for Medicare and Medicaid recently put out a policy called GUIDE. It's GUIDE, and it's specific for caregivers of persons with dementia. And it offers education and training and things like that. And then there's another CMS guideline that's going out there on all these social determinants of health that we talked about earlier, where in 2024 and beyond, there's going to be requirements for social workers and for physician practices to screen for these social determinants of health, which might lead an employer to think, maybe we should be screening for these if people would give us confidential responses. Because what that can do for employers is it can tell you, do I have employees that don't go to the doctor because they're afraid of taking a day off work, or they can't afford the $25 copay? Or maybe do I have an employee that's not going to get a mammogram or a colonoscopy because it's a $500, deductible and they can't afford it? So as an employer, unless you really understand what's going on with your employee population, you can't possibly do anything about it, right? You don't know, you can't do anything about it. You have these blinders on. And so this whole push toward social determinants of health assessments is going to help the clinical side of healthcare, right? So the doctors, all of those people. But what's needed is the other side. So it's the other side of, if people need nutrition, if somebody's diabetic and they can't afford food, is there a food bank? Are there other resources? Are there transportation resources? Are there resources for health literacy if somebody goes to the doctor and they get this list of recommendations and they're like, I have no idea what this means and I have nobody to explain it to me and I can't do it. So this kind of leads into all of the things that companies can start doing for their employees. So these are potential supports. And again, it definitely depends on, if you're a small company of 10 people, you may not be able to do a lot. Whereas if you are a larger company with 50 or 100 or 2,000, or maybe you're a regional company or a national company, the more things you can do. But the one thing that you can do, regardless, is to allow discussions about health and well-being and bring in caregiving in the workplace and compassion and empathy for people's lives, because that will help you retain employees. It's going to help you not lose those employees who are afraid of telling you something because, oh my gosh, I'm going to lose my job, or I'm not going to get promoted. Or if my supervisor knows I have this problem, they're going to think my life is a mess. Well, honestly, on any given day, who doesn't have problems? We all have problems. So the number 2 list on this potential employer supports is what I call healthcare access and navigation. So let's say that your company maybe does a lot of focus on health, and you have employees who actually come to a location, right? A lot of companies will do health fairs and they will bring buses in. So like buses can come and do, cholesterol checks and blood pressure checks and all of those kinds of things, because that is the health prevention that can help employees identify problems early. If I had to guess, I would say that most people, if you're relatively healthy, either don't have a primary care doctor or you don't go get a checkup every year. And the reason you don't go is because you're healthy and nothing's wrong. Or you think, oh, I have this little cold, but you know what? It's going to go away in 2 weeks or 3 weeks. So as an employer, as a company, if you can bring in health screenings and you can bring in ways to involve people in their health, to identify issues early and talk about the importance of, have you had a checkup in the past year? Most people don't even know how to use their health insurance, right? I mean, you have it, right? You're healthy, you have it. You think, well, if something happens, I'm going to use it. But the reason to have health insurance is going to sound crazy, but it's to actually use it and to go get those preventative screenings and to have a doctor that you see every year so that they can track your health. So sometimes to get employees to do that, employers have to make it super, super easy. So schedule on-site clinics, schedule on-site testing, talk about, going to primary care physicians. There's always a tendency if somebody gets sick, we go to the quote doc in the box, right? The clinic at the grocery store, the clinic at a, local pharmacy or whatever, which is great because you get immediate care, but then you don't follow up with a doctor because you may not have a doctor. So it's really the baseline of saying, okay, for everybody in this company, we have insurance benefits. Let us teach you a little bit about how to use them and why you should use them. The other thing that companies can do is they can look at the range of employees that you have, right? So, let's say that maybe you have people who are making, $20 an hour and you have people who are making $50 an hour, but they have the same health insurance plan, right? So obviously the people that make more money can afford to pay those copays. But maybe somebody who makes $20 an hour and they've got 5 kids they're supporting and they got a wife and all of that, they can't afford those copays. So can the company set up a fund to say, look, we want you to get medical care. If you can't afford to pay the $25 copay, we have a fund. We want you to go to the doctor. All you got to do is fill out a form. It's confidential. And either the employee can arrange to fill out that form and get the payment. Maybe you have a company in the middle that does it to maintain confidentiality, but help the people that can't afford, even though they have insurance, to get that care versus the people who can afford it, because there's such gaps in employee populations, right? And do those surveys on the health drivers. So I know some large companies, hospital systems, in fact, that have established relationships with community organizations. So maybe like a food bank, right? The company donates money to the food bank and they tell their employees, hey, you know what? If you have a health condition like diabetes or something else and you need really healthy food and your grocery bill is just crazy these days because of inflation, right? We participate in this food bank. Please go take advantage of this service. It's out there. It's confidential. We're not going to know whether you go or not, but it does exist. Same thing with, employee resource groups, employee resource organizations, all of those types of things. The idea is that in communities and for employers, we want to support this idea of no wrong door, right? And so what no wrong door means is that, if your employee has a food need, let's say they show up at a food bank, right? And the food bank, starts giving them food and they come there and they get to talking to somebody at the food bank. And somebody at the food bank says, well, I see that you need food. Do you have a medical care need? And that employee at the food bank may learn something about this person and may be able to refer them to somebody else. So in communities, there are what are called community care hubs or social care networks. I know that I think I saw the Area Agency on Aging is a sponsor of this presentation today. And so many area agency on agings have information and referral networks. Some of them participate in a program. It's called Trilogy. It's a national program where you go onto this website and there's all these doctors and there's food resources and there's education resources and all of that. So the more that employers can connect employees to resources and actually empower the employees to participate, again, it all comes back to work and quality of life and their ability to be a good employee. The other thing that is not taught in schools today, that is so lacking, is health literacy and financial literacy. And this is, again, where employers who, let's say you have a 401k plan or you allow employees to contribute to their retirement plans. Well, part of retirement planning is talking about getting old and having health concerns. And how are you going to plan for those costs? And so that kind of goes back into all of this health prevention and everything, right? And let's talk about Medicare for a minute. So if you have employees who are caring for parents over 65, right, they're on Medicare. And if you watch TV right now, you know that it's crazy Medicare open enrollment period. But what most employees don't realize and what most workplaces don't do a lot of education about is There's original Medicare, and there's all these Medicare Advantage programs. And it's important for employees who are reaching retirement age to know about that, but it's also important for your employees who are caregivers of older adults to know about that. So while you may think, gosh, doing a Medicare, program for our employees would be absolutely crazy, you can do it in the context of, we're going to talk about health insurance. Hey, we got a health fair this week, and here's this whole segment on health insurance. And we're going to teach you how to use the health insurance that you have, right? Because as an employer, your premiums go up if you have employees who are sick, right? They're sick or they have cancer and they're making a lot of claims. Your premiums are going sky high, right? You would be better to encourage your employees to go for preventative care to catch these things before they become larger expenses. So, hey, we're going to do a session on health insurance, and we're going to teach you about like the company health insurance that you have. But, if you're a caregiver for an older person, we're going to talk about Medicare, just so you should know how this works. And so for your employee caregivers of older parents, Medicare has an annual wellness visit, right? And it's totally covered by Medicare. And that's kind of like an annual checkup that your caregiver should go to. So like if you're caring for somebody, you should mirror the behavior that you want them to have. You want your parents to go get a checkup. You should get a checkup. You want your parents to go get their teeth cleaned. You should get your teeth cleaned. So you talk about all this in the context of how do you use your health insurance to keep you healthier and to care for the people that you care for. Medicare also pays for, I call it a preventative long-term care discussion, right? So advanced care planning. So if anybody here is from a hospice company, you know how important it is to talk about, what do I want if I get sick? Do I want to go to a nursing home, or do I want extensive treatment, which gets into all of this legal stuff, right? So the power of attorney, the medical power of attorney, the living wills, the wills of trust, and things like that, which goes back to financial and health literacy. And so some employers have legal benefits that they offer to their employees where you can maybe go get a will done or a living will. So again, talking about all of this as part of really a life plan, right? For your well-being and your health. And you may need some of it now, but you may need some of it later. And if you're caring for people outside of the workplace, they're going to need all this. So we want to make sure that you are armed and educated with all of the information that you need. Now, here's always the risk, right? If you're an employer, you may say, hey, we have this, great program and we're doing it. And you send it out and nobody shows up, right? And so it could be because you called it a caregiving program and you have all these employees who may be caregivers, but they're like, well, I don't identify by that name, or I don't need to know about health insurance, or I don't need to know about this. And so what you have to do is you have to frame it in a bigger topic. And you send the invitation out, but if employees do not want to attend, right, you make them opt out instead of opt in. And you actually make time for them to attend. So it's like, 10 o'clock, 2 weeks from now, everybody shows up. Or you schedule the same information a couple of times during the month in case, you can't have everybody out of the office at the same time, but you make it available to them and you encourage them to attend. You can also record it and offer those replays. But the idea is, this is not really an optional thing for you. I mean, you can opt out, right? But you have to say, I'm not going to participate, versus here it is. We want you to show up. We want you to participate because somewhere in here, there's something valuable for you. And again, if you do those surveys, if you do the social determinants of health assessments, you'll kind of know where your people are and what they're looking for. And I'm noticing, just side note, right? Nobody has asked a single question in the chat. So please do ask questions now, because it's kind of like we're offering all this information and y'all are taking it in, and we see that, right? But questions are important, and having conversations about this is so important because it really is the whole scope of life. And so there are companies who do volunteer events for employees, right? You want to get your employees involved in things. And so you say, well, we're going to adopt a family, or we're going to do this cause, or we're going to do that cause. Well, what if instead you chose a cause that was an employee need of yours, right? So that employees don't go, again, we'll use doctors, right? So maybe you have a primary care physician come and talk about the importance of primary care, or you have a nurse educator come and talk about common things that people should watch out for, or like if you have high blood pressure, what should you do about it? And how all of these chronic diseases roll into one and into the next and into the next, because if you're an employee and you're caring for somebody, again, this is important for you to know. And even to the point of, you go to a doctor appointment, what questions as an employee should you be asking for yourself? What questions should you be asking for the people that you care for? Because the more empowered your employees feel to have the confidence to ask about all the stuff that they cannot even possibly know is going to happen, the better all of this works. And so all of these groups, the more that you can make health be a common topic, the more important it is. And even to the point where some companies I know will schedule like once a quarter, a day. This is your day. You need to go to a doctor appointment or whatever, take it, schedule it, do it. They encourage things like that. Okay, so there's a question here about FMLA. I'm not an HR person. I could answer it, but I don't want to give you the wrong answer. So if you want to know about how long you can get paid under FMLA for caregiving, go to your HR department, because I don't want to misstate that. But it is weeks. I will tell you that, because I've had employees do that. So they've taken off 4 weeks or 8 weeks or 12 weeks. I think an emergency leave pool, this is a great question. Thank you so much, is awesome. So years ago, so let me just kind of give you some context. So my first foray into healthcare, right, was a non-medical caregiver agency. And we had a pool there for employees who were sick or couldn't show up. And we called it the sub club, right? So if you were a caregiver and you needed to get to work and you had, let's say your child was sick that day, there were other people in the sub club, right, that could go to work for you and take that shift. I think it's great to allow to have this emergency leave pool, or what I call a sub pool of employees who are like, you know what, you got to take 4 days off to take care of your dad. The team of us are going to help you get your work done. We just need to know that you need to take 4 days off and you don't worry about it. You go take care of stuff, because when we need this type of help, we may need you to step in for us. So again, the more that you can talk about employee teams and subclubs and people stepping in, and these employee resource groups who are there maybe to help people. Maybe you have an employee who, they have to take family leave, right? And that somebody was in the emergency room. And so maybe a bunch of employees volunteer to go take meals over to that person. It's almost like you can establish these care groups or support groups within companies of employees who can help. And I don't say, I'm not saying like, don't, adopt a volunteer agency outside of the company, because that can be good too, because caregivers will volunteer, but you got to help people plan. And so this is going to kind of take us to this whole caregivers who become informed and educated advocates are better. And this whole support care plan. So this is a whole big picture of what employers can do. Okay. It's help employees research and understand what their options are, whether it's how to use their health insurance, whether it's how to save for a 401k, whether you have options to help them pay for a copay, whether, if they need food, there's a food bank associated with the company. You want to be able to help people evaluate the pros and cons, right? If I have a parent who's on Medicare and it's open enrollment, should they stay with their current Medicare plan? Is there a better Medicare plan? How do you look at the costs of those type of plans and decide what's better? And then how to create what I call backup plans, because crazy stuff happens. And thanks to all the people in here who are answering FMLA, I really didn't want to misspeak to that. In caregiving, you want to have these ABC plans, right? So right now, mom or dad are okay, and I'm taking care of them, and I can work, and there's no problem. But what happens if mom or dad have to have surgery? Do I have support from teammates in the workplace? Can I take time off? So have employees investigate, if I need time off, is it there? How do I ask for it before something happens that they actually need about it? So imagine doing workplace education about FMLA, for people who need it. And then the other plans about, if you're an employee and you're diagnosed with cancer and you want to keep working, how do you keep doing that? Or if you have a loved one who's diagnosed with cancer and you have to take them to chemo treatments or other things like that, how do you deal with those types of things? And then the whole reality of, if you're working and you have kids and you have a career and you've got parents, how do you be realistic about what you can accomplish? Because so many of us, We underestimate the amount of time that it takes to do things, right? So we overschedule our lives, and then we're all stressed out and we can't cope and we're not sleeping. And then we, as the caregiver, get sick. And really, all any of us can do in any of these situations is to do the best that we can. But going back to employers, so health literacy, financial literacy, huge topics, broad topics. I really do encourage employers to offer as much education about this as possible because it benefits you, right? You're trying to control your healthcare costs and your premiums from the health insurance that you offer, right? You're trying to get your people to come to work, right? Healthy, not sick. You have all these people who are having all these issues and you may or may not know about them. So the more that you can do in all of these realms of education and to opt people in, to invite them to come and make them say, well, you know, I don't need that right now. I'm going to opt out. Because you never know what information people are going to need. And if you can record it and put it on an internal intranet, all the better, so that you have all these resources for employees who may not need it today, but they may need it in a week or in 2 weeks. And I'll just share, I got to close out, but I'm going to share one quick story. So long-term care insurance is definitely something that a lot of corporations offer. I had a company who offered it to employees, and this couple opted out. They didn't need it. 2 weeks later, this man was diagnosed with Lou Gehrig's disease. And if you have a diagnosis like that, you can't go back and get long-term care insurance, right? But there wasn't a lot of education on why to do it and why not to do it, and whether companies can create part of those premiums and how that works. So that's another long-term care planning support. So I am going to stop sharing my screen, and I wanted to see if people have questions. And if you don't, I can talk a little bit more about common questions that I get from either employers or caregivers. So if you have questions, please put them in the chat down there. I'm going to talk about paying for care, right? So paying for care is a worry that a lot of employees have, and for themselves or for caregivers. So Medicaid is a huge concern. So if your parents don't have money to pay for care and you're an employee, you might be thinking, oh my gosh, I have to work and I got to pay for their care, and how am I going to pay for my kids? I encourage all employees, regardless of who you're caring for, and even yourself, right? If you are a lower income employee, investigate your state Medicaid program, because there are a lot of programs for children, for prescription drugs, for medications, for health plans, for community health centers. So community health center is a great place to go. The copays there are usually lower. They have a lot of social workers and case managers who can do education. They can talk to you about a lot of community programs. So investigate the state Medicaid program and what it pays for, what it takes to qualify, especially for elder parents. In many cases for the elderly, it's low income and it's a need for care. So activities of daily living. I know there's home health care companies on here, but you know, assistance with bathing and dressing and meals and medications and all of those types of things. So investigate how you pay for care, whether it's through Medicare, whether it's through your retirement savings program, whether it's through a long-term care insurance program that your company offers. I can tell you that there are 3 states right now. I think it's Washington, California, and New York. The state legislations are actually mandating long-term care insurance premiums through payroll deductions. So if this hasn't come to Connecticut yet, it may be there soon. Because what states are realizing is that people don't have enough money to pay for nursing home care or for in-home care or even for assisted living when parents get old. And so what they're trying to do is say, okay, we're going to take payroll deductions today so that when you are 65, there's at least a little bit of a pool of money here to help you. Now, that doesn't say that companies who offer long-term care insurance employees will have the choice to opt into those programs depending on the state again, or you can buy your own. But it's truly, you know, if you have a great HR organization, a company that really cares, there's so many options that you can look at to help your employees to work through all of these issues. And really, it does depend on the type of company, your number of employees, the employee needs, whether you're local, whether you're regional, whether you're national, what your budgets are, all of that. It does depend on a lot of things, but just even if you don't have a lot of money, just talking about it and making it okay to have these conversations in the workplace and to offer education. You know, there's a lot of people who will come, like all of us here today, to offer education because we believe in this cause. So never be afraid to go outside of your company and seek out people at resources, people that can come and do education for you. That even if you have to record it because people cannot attend, you can offer it later. It's the idea of having resources available for your employees when you need them. So that is, I know we got to go on and take a break to get to the next session. Steve, thank you so much. Everybody, thank you for the people that did ask questions. I appreciate it.